Last week marked 6 months since the World Health Organization, or WHO, was notified of an outbreak of Ebola virus disease in Guinea. This outbreak has since evolved into the largest Ebola outbreak in history.
For the past 5 months, Ebola has ravaged Western Africa. 1,400 have been reported dead, 2,600 infected. The outbreak has struck several countries, the worst of it here in Liberia, a ground zero for the epidemic.
The three most affected countries, Guinea, Liberia and Sierra Leone, faced enormous challenges in stopping its transmission and providing care for all patients in what is seen as the most severe and complex outbreak in the history of the disease.
The number of new cases is moving far faster than the capacity to manage them.
As countries strengthen their preparedness activities, educating the public on the signs, symptoms and mode of transmission, as well as providing information on its prevention, diagnosis and treatment, protective measures were also being taken for health workers to reduce the risk of EVD spreading. Although the risk of EVD transmission is low, health workers, family members, and those in close contact with people suffering from the disease, even those who have already died from it, are at a higher risk of infection. EVD is transmitted through skin lesions or mucous membranes by direct contact with blood, body fluids, or the secretions such as feces, urine, saliva, vomit, semen of infected people. Infection can also occur if a skin lesion or the mucous membrane of a healthy person comes into contact with environments that have become contaminated with an Ebola patient's infectious fluids such as soiled clothing, bed linen, or used needles. To date, over 370 workers have been infected and more than 200 of them have died while caring for Ebola patients. This is likely to have happened because they were not wearing personal protection equipment or PPE or were not properly applying infection prevention or control measures when caring for the patients. WHO supplied PPE, which included masks, gloves, gowns and eye protection to the Lao Ministry of Health for health workers screening for Ebola at hospitals, airports and friendship bridges. According to WHO representative to Laos, besides supplying health workers with protective gear and training on infection prevention and control practices, WHO is also supporting the Ministry of Health in adopting the Asia-Pacific Strategy for Emerging Diseases or APSA 2010 Focus Areas and International Health Regulations or IHR 2005 Core Capacities in the implementation of preparedness activities and operational planning in response to Ebola. A full-scale drill and tabletop simulation exercise will be held to validate the contingency and response plans for immediate measures and to ensure that there is capacity to detect, investigate, and manage Ebola imported cases should they happen. Since August, EVD has been included in the list of topics the Emergency Operations Center monitors and reviews daily in coordination with other countries in the region. At the recent ASEAN Interparliamentary Assembly or IPA meeting, the topic of EVD was also highlighted and a draft resolution to be passed by ASEAN member states on strengthening cooperation among IPA member parliaments on EVD was written, highlighting the importance placed on preparedness and cooperation.